High blood pressure or hypertension is a condition that affects 1 in every 3 Americans in this country. Now, although high blood pressure is not a disease, it is one of the #1 indicators that someone is at risk of heart disease, stroke, and other serious health problems. Researchers are now finding that vitamin D supplementation plays a major role in lowering blood pressure in those who have hypertension. If you are one of the millions of Americans dealing with high blood pressure, adding more vitamin D to your life could be the solution you've been looking for. So, in this video, we're going to explore how vitamin D lowers blood pressure, and we're also going to talk about a couple of ways that you can add more vitamin D to your life. Stay tuned. What's going on, family? This is Edward Williams, licensed physician assistant, founder and creator of Health by Any Means Necessary, and I want to welcome you to our channel. We talk about all things practical health improvement, fasting, and insulin resistant. So if you're new around here, please be sure to subscribe, hit the like button. That way you can be notified every time we go live. All right, so let's get into this video. All right, so there was a study done by the American Journal of Clinical Nutrition, and pretty much they wanted to see if vitamin D plays any role in decreasing blood pressure in those who have hypertension, of course. And so what they did was, for 12 weeks, they took people who have high blood pressure and they gave them vitamin D supplementation for 12 weeks. And what they found was that after 12 weeks, the systolic number, which is the top number of the blood pressure reading, dropped by 7 points. They also saw that the diastolic number, which is the bottom number on the blood pressure reading, dropped by 5 points. Now, for those who know, you understand that that is a significant drop. And once I explain to you just how much that helps out as far as the overall health of your heart and your cardiovascular system, you too will understand why that's such a major drop and major impact on blood pressure and overall heart health. So the question you may be asking is, how does vitamin D help lower blood pressure in those who have hypertension? Well, there's multiple ways. But in this video, we're going to cover 3 ways that vitamin D supplementation improves blood pressure in those who have hypertension. All right, so the first way that vitamin D helps to lower blood pressure is vitamin D improves the health of the endothelium. Now, for most people, they're really not sure what the endothelium is. And if you've been following me for a while or you've been watching my content for a while, you understand that I love talking about the endothelium. The endothelium, for one, is the thin layer of cells that lines our arteries. The other part that you may not know about in the endothelium, which a lot of people don't know, is that the endothelium is actually an organ. Completely different subject, completely different video. I have a course called The Truth About High Blood Pressure, where you can learn more about that truth. But for the sake of this conversation, the endothelium, just like any other organ in your body, has a job. The endothelium plays a major role in the regulation of blood pressure by releasing a molecule that can cause vasoconstriction or vasodilation, relaxing the arteries of the cardiovascular system. In addition to that, the endothelium also plays a major role in regulating the viscosity of the blood, which is the thickness of blood, and it also plays a major role in the clotting system of your blood. So once again, the endothelium secretes a molecule called nitric oxide. Now, in this case, because the endothelium, which is an organ, is secreting this molecule, that molecule now becomes a hormone. So nitric oxide, when secreted from the endothelium, is actually a hormone. And so the endothelium controls this hormone and releases it, and it plays a major role in causing vasodilation, which means the relaxation of the arteries, the entire vascular system. And this allows the vascular system to function properly and also keeps the vascular system healthy. However, endothelial dysfunction is a very common dysfunction that many people have that can lead to not only high blood pressure, but cardiovascular disease in general. Vitamin D deficiency has been tightly linked to endothelial dysfunction. In fact, it has been shown that vitamin D plays a major role in ensuring that the endothelium functions properly and also stays healthy. And in addition to that, it has also been shown that vitamin D helps promote the release of nitric oxide, which once again helps to relax the vessels, which once again lowers blood pressure. Next, the second way that vitamin D helps to lower blood pressure is by reducing inflammation. Vitamin D helps to reduce inflammation by inhibiting or decreasing the improper secretion of cytokines, which causes the inflammation. Another study was done from a team of researchers from the UK and Australia who wanted to see what the correlation was between vitamin D levels and inflammatory markers. And what they found with those who had higher levels of vitamin D had lower levels of inflammation markers, which they also had lower blood pressure, which also lowers the risk for heart disease, stroke, and other serious health conditions. In addition to that, they also found the inverse. Those who had lower levels of vitamin D had higher markers of inflammation as well as higher blood pressure, and higher blood pressure is a risk factor for heart disease, stroke, and other serious complications. So the findings suggest that vitamin D supplementation can play an important role in decreasing the risk of inflammatory conditions such as cardiovascular disease. Next, the third way that vitamin D helps to lower blood pressure is that vitamin D helps to prevent and or decrease insulin resistance. Now, you all know I talk about insulin resistance all the time. And what you have to understand is that in the face of insulin resistance, there is usually higher levels of high blood sugar. And so what you have to understand about having high blood sugar is that over time, not only is this very damaging to the endothelium and your vascular system and your life in general, but also that high blood sugar is causing damage to your arteries, also causing inflammation. And so this brings us back to the previous way that vitamin D helps out is by decreasing inflammation. But for the sake of conversation as pertains to insulin resistance, with insulin resistance, you're going to have high blood sugar. With the high blood sugar is going to cause damage to the lining of the arteries, the endothelium. It's going to cause inflammation. And over time, this will cause high blood pressure. Now, in the case of vitamin D is going to help by increasing the insulin sensitivity of the cells, which will then help to increase the uptake of glucose from the bloodstream, thus lowering the blood sugar in the bloodstream. And so over time, this will help decrease overall blood sugar, which will then help decrease blood pressure. Overall, those three ways that I just listed will help decrease blood pressure. When you have a decreased blood pressure, you're going to decrease the workload on your heart. And when you decrease the workload in your heart, you're going to help increase the longevity of your heart and your cardiovascular system in general. In addition to that, by decreasing blood pressure in a natural way without medications, this also means that you have a decreased systemic vascular resistance. Overall, this will help decrease your chances of heart disease, stroke, and other serious problems. So this is the overall point that I want you all to get. You want to decrease blood pressure, not for the sake of having a lower number, but you want to decrease your blood pressure because it's going to decrease the workload on your heart, and it's also going to decrease overall vascular resistance, which is a great thing as pertains to longevity and being healthy in general. All right, so what are the best ways to get more vitamin D into your life? Well, there's two ways that I mainly recommend. The first way, which is my primary recommendation, is getting more sun exposure. Now, right now, because of our lifestyle, the majority of the country, the majority of the world finds themselves to be vitamin D deficient. And this is because many of us work in offices, we're in vehicles for a large amount of time during the day, we're in housing, and many of us are not out and about outside the way we used to be, the way our ancestors used to be. And so many people are deficient in vitamin D because of the lack of sun exposure. So my primary recommendation to get more vitamin D is by getting more sun exposure. And by getting more sun exposure, I'm talking about 30 minutes to an hour a day. But you want to make sure that you're walking around, your arms are exposed. If possible, you want your chest and your back to be exposed. That way you can try to get as much exposure as possible in a safe way. Of course, you have to kind of gauge that based on your skin pigmentation. So someone like me, I'm darker, I can be out in the sun, no sunscreen, no sunblock, no problems. The lighter your skin gets, the more you may want to be cautious of your sun exposure, and you may want to look at putting something like shea butter or coconut oil on your skin if you're concerned with sunburns. I don't recommend sunblock in general, but that's me. And finally, the next way to increase the amount of vitamin D you're getting in your life is by taking a vitamin D supplement. Now, when you try to find a vitamin D supplement, it's very important that you get the vitamin D3, not vitamin D2. So vitamin D3 is actually the active form of the vitamin D that is produced by your body in response to sunlight. It's also the most bioavailable form of vitamin D, and it's also more effective at raising your vitamin D levels. In addition to making sure that you get vitamin D3, also try to find one that has vitamin D3 with K2. This is because with the vitamin D, you're going to have more calcium absorption. Without the proper amount of vitamin K2, that calcium may get deposited in areas that it should not be, such as your arteries, which of course, this can be a problem. With the proper amount of K2 that you're taking in with the D3, this is going to ensure that the calcium is being placed where it should be, such as your bones. Now, the doses of vitamin D3 can vary widely from company to company, brand to brand. But I recommend taking a vitamin D3 supplement that has 5,000 international units per capsule. In addition to that, you want to make sure that when you take that vitamin D3, that you're taking it with food. That way you don't have an upset stomach or feel nauseous after taking that vitamin D3. All right, so in conclusion, as you can see, vitamin D plays a major role in lowering your blood pressure for people who have hypertension. We talked about the 3 ways. Vitamin D helps to improve the health of your endothelium, which is an organ that secretes a hormone called nitric oxide. Number 2, vitamin D helps to decrease overall inflammation, but specifically in the arteries, which once again will help decrease your blood pressure. And then number 3, vitamin D helps to decrease insulin resistance by decreasing your blood sugar, which will also decrease your overall blood pressure. We also talk about the ways to increase your vitamin D intake by more sun exposure, 30 minutes to an hour, followed by vitamin D supplementation, roughly 5,000 international units per day. Lastly, if you are interested in purchasing vitamin D3, please be sure to check the link below. You can find our 5-star rated vitamin D3 with K2, which has great reviews, also has a great price, and we're also having a sale right now on those supplements. So click the link below if you want to learn more. All right, family, this is your brother, Edward Williams, signing off, and I'll holler at you all later. All right, peace.